So the first application we're going to review today is the FAST exam, which is the rapid assessment of ultrasound use in a trauma patient. The probe that you want to use for this type of application is the small footprint phased array probe that is located on every single emergency medicine ultrasound machine in the department. You'll notice on the probe that there is a dot and a side without a dot. The dot, when doing the exam, needs to be either towards the patient's right side, if a transverse image is being obtained, or towards the patient's head, if a longitudinal image is being obtained. Place a copious amount of gel on the head of the transducer in order to allow the sound beam to transmit. Please replace the cap on the gel so that it doesn't leak all over the machine. Then what you do for the first portion of the FAST exam is you take a look at the Morrison's pouch, which is the right upper quadrant view. It's usually obtained by placing the probe in approximately the mid-axillary line below the lower rib margins. Pause. This is the first view in the blunt trauma patient because it's the most sensitive for evaluation of free fluid from an injury to the solid structures of the spleen or the liver. It is obtained by initially placing the probe in a coronal longitudinal orientation in approximately the mid-axillary line, and then slightly rotating the probe backwards so that it goes obliquely through the ribs. When looking at the screen, what one envisions at this point is a Morrison's pouch, which is the potential space between the liver and the right kidney for evaluation of fluid. And then, if one is concerned about the possibility of hemothorax, you move upwards one interspace to take a look to see if you see any black fluid collections between the ribs above the diaphragm. However, you will often need to move down one interspace in order to get the inferior pole of the kidney.